Nestled between the Himalayas and the Karakoram mountain ranges lies the district of Baltistan in the northern areas of Pakistan, both idyllic and remote. With a population of around 500,000, the valley and its surroundings remain almost pristine, yet this splendour is eclipsed by a severe lack of development where basic human needs and facilities are hard to come by. Geographically, a far-flung part of Pakistan, accessible only by the Karakoram Highway, approximately 28 hours drive from the capital, Islamabad, or can be reached by a spectacular 1-hour flight from Islamabad. The area of Baltistan spreads over 10,118 square kilometres. Agriculture based on terraced farming is the mainstay of the people. The monsoon rains do not reach the area. Thus, in the absence of rain, glacial water streams and rivers are the main source of irrigation. There are no industries or factories, hence no source of employment except for government jobs, which are far and few, and to some extent tourism. Thus, unemployment is the norm. Belonging to the village of Sermik, 46 kilometers from the Balti capital of Skadu, Dr Sikandar Hayat Khan, a celebrated surgeon with more than 40 years' experience, was intimately aware of the circumstances that afflicted his people. Having been actively involved in philanthropy throughout the area for decades, Dr Khan realised the pressing need for a medical facility for Sermik and beyond, and in 2008, with his own funds, founded the Zubeda Khaliq Memorial Hospital.
This hospital took 3 years to build. First year we treated 10,000 patients, and in the 5th year the figure has reached 60,000, and hopefully at the end of this year we hope to reach the figure of between 80 and 90,000 patients. Another thing about this hospital is, which sets it apart from its contemporaries, is that, for example, last year we treated 60,000 patients. This included hospitalization, drugs, post-operative care, sutures, etc., etc. Now, with a total budget of $175,000, this amounts to $2.30 per patient. Now, if you compare this to any contemporary hospital in Pakistan, what to talk of best? This is about 7 to 9 times cheaper.
As the first and only pro bono medical health facility in the area, the Zubeda Khaliq Memorial Hospital has been groundbreaking, introducing a unique medical narrative to the area and its people.
चार महीनों से तकलीफ है, काफ़ी पैसा हमने खर्च किया, फिर भी हमें कुछ फर्क ही नहीं हुई। इधर कल ऑपरेशन किया, आज बहुत सेहत आज से बहुत ठीक है। उम्मीद है, पूरा उम्मीद है हम ठीक होंगे।
खुद चलना है, ठीक है?
Standing today as a 75-bed facility with 50 staff members, the hospital is equipped with 4 operation theatres, X-ray and ultrasound facilities, an OPD, a pathology laboratory, a dispensary, a maternity ward, as well as a newly established emergency ward.
यहाँ पर डेली के तकरीबन 30 से 35 पेशेंट मैं देखती हूँ और ये तकरीबन एवरेज मंथली 1000 के करीब बन जाते हैं। कम से कम महीने में 15 से 20-30 डिलीवरीज हो जाती हैं। इसके अलावा सिजेरियंस भी काफ़ी हमने किए हैं और मेजर सर्जरीज़ गायनी से रिलेटेड जिसे हिस्टेक्टमीज़ कहते हैं हम, वेजाइनल और एब्डोमिनल हिस्टेक्टमीज़, ये हमने प्रोसीजर्स किए हैं। मायोमेक्टमीज़ भी की हैं हमने, लेप्रोटमीज़ की हैं सिस्ट्स वगैरह के लिए। ये सारे प्रोसीजर्स हम यहाँ पर परफॉर्म कर रहे हैं। कई पेशेंट्स ऐसे हैं जिनकी ज़िंदगी को हमने इस तरीके से बचाया है और उनके रिलेटिव्स का कहना है कि अगर हम इसे स्कर्दू ले जाते तो यकीनन ये पेशेंट, क्योंकि डिस्टेंस काफ़ी है, तो उसने पेशेंट की डेथ रास्ते में बहुत सारे पेशेंट्स की इस तरीके से हुई है।
The hospital treats all its patients for free and, since its establishment, has successfully treated at least 200,000 patients, with 2012 alone seeing 60,000 patients, of which female and children were the majority.
Las mamayan ma zaga, chan samayan mga bistarin duksit piniatris, chan las mayan ma frushana bar besangas kardo osit pin, se frusha karma it pin nga ilash las kardo osit pin pa. Le lehmo sojungala, yasman ilash kun lehmo soset, tishukuriya.
دي अस्पताल में थी वहाँ लंगा बस इलाज स्कार दो बस इलाज बस दे दाइमों लेहमों में छुक पट फुट भां थे ने तंगाला तकलीफ ताने गाले दो लेहमों में छुं गाया दे या गुआ पैशारिया सम ये अस्पताल में तो या खुदा नूर सोंसर में छुं इलाज गई दे गाले यो
Professionally run with a dedicated staff, the hospital operates on donations from all over the world at a fraction of the cost public hospitals run at. Indeed, the present per-patient cost of the hospital is unmatched by any other country in the developing world.
पहली हॉस्पिटल नहीं थी, डिस्पेंसरी एक थी, सिर्फ दवाई मिलते थे, ऑपरेशन नहीं होते थे, मतलब पेशेंट की केयर सही तरह नहीं होते थे। फिर हॉस्पिटल बनी, ऑपरेशन होने शुरू हो गए, हर जगह से आते हैं अब पेशेंट। हमारा मसला है बस नर्सों की कमी है, हम 3 हैं सिर्फ, एक मॉर्निंग करते हैं, एक इवनिंग करते हैं, एक नाइट करते हैं।
यहाँ जो है जी बहुत ख्याल रखते हैं, ये स्टाफ भी बहुत अच्छे हैं, ये जो नर्स हैं, नर्सिंग वगैरह हैं, ये भी बहुत अखलाकी हैं, बड़े अच्छी तरह से पेश आते हैं और बहुत अच्छी तरह से इलाज करते हैं।
Of course, the hospital services are not limited to Cermak alone, as in 2010, it introduced a novel outreach programme in which staff and doctors would visit remote and inaccessible communities to quite literally provide healthcare at their doorstep. The outreach programme is meant to treat people in remote and inaccessible places who can't access the hospital due to distance and financial constraints.
बाहर मुख्तलिफ़ इलाक़ों में मेडिकल कैंप लगाने का ये फ़ायदा होता है सर। वहाँ से कोई मरीज़ मतलब मुश्किल होता है उधर से इधर आना, कि किसी के पास गरीब लोग होते हैं, पैसे नहीं होते हैं, या किसी को पता ही नहीं चलता होगा वहाँ पे रेडियो नहीं है या कोई और ज़राए नहीं है, तो पता नहीं चलता कि यहाँ पे कोई डॉक्टर आए हुए हैं, तो हम वहाँ जाके मेडिसिन देते हैं और उनको शूर दिलाते हैं कि हमारे यहाँ पे हर सहूलत है, आप लोग आए और हमारे साथ मतलब ताउन करें तो हम आप लोगों को हर सहूलत हम दे सकते हैं।
In addition, there are also permanent outreach health clinics located in the towns of Rondu, Astor and Shiga, as well as 15 outreach dispensaries in smaller locations, manned by paramedics and regularly visited by doctors of the hospital.
What distinguishes it from the other hospitals is that the cream of the specialists in Pakistan, mostly from Islamabad, Rawalpindi and Lahore, come here voluntarily like me and spend time and treat patients, do the surgery under the circumstances and give them that facility for which even when you go to a big hospital in Islamabad or in Karachi or anywhere else, you have to have a long waiting list.
Apart from the full-time staff at the hospital, which includes a gynecologist, 4 resident doctors and part-time medical specialists, including neurosurgeons, cardiologists, dermatologists and orthopaedic surgeons come and work on a voluntary basis at the hospital from Pakistan, UK, Canada and USA.
I keep coming back because it makes me feel good that I've been able to help some of the people that perhaps I would have never been able to help if I would have been sitting in Islamabad. We never had any mortality and we never had any morbidity. So the reason for that was not, it was also our selection. We always operate on those cases here that would really have best results. For example, if a patient has got a problem with the spine and he cannot walk for 10 yards, we know that it is spinal stenosis. All you have to do is examine him properly, take a proper history and do an X-ray and operate. And about 50% of our cases were like this. It's very common in this part of the world because people have labor work and they usually bring their loads on their back. So therefore they have problems with their back. And I've seen the best results. The people have gone back to work. And one of the things that is phenomenal is the reception. When the next time you come, they not only come alone, but they come with so many other patients. So it's from patient to patient referral. Look, I got better, so you better come.
Having established itself as one of the leading healthcare facilities in Baltistan, the Zubeda Khaliq Memorial Hospital now looks to expanding, hoping to treat at least 20% of the people of Baltistan in 3 years' time. In order to further this goal, the hospital is now focusing on adding 50 more beds and an additional operation theatre to its existing facilities, along with a blood bank, vaccination services, an ambulance and, most importantly, an endowment fund that will continue to help the people of the region and better their lives.
I would, like to appeal to our doctors in Pakistan and abroad to invest some of their time, expertise, and some funds to alleviate the terrible conditions of this forgotten part of Pakistan.
We will be able to kind of serve all these people only when perhaps by the time that they would be able to do an optimum services here, probably they will need 10 crores of rupees a year budget. For that, I think that everybody has to contribute, especially for those Pakistanis who have settled abroad. They can really play a great role in making a great success here. It will spread like a fire, inshallah.
Ladies and gentlemen, in the end, I would like to speak a few more words. As I said before, it's a small effort on our part and gradually it's grown into something much larger. Essentially, this is a very far-flung part of Pakistan. The access is very difficult. The nearest hospital is 28 hours harrowing bus journey. Moreover, the people are being extremely poor, are unable to buy any medical aid on top of, except the small which we provide, you see. Over the years, this hospital has grown to 75 beds and we are providing medical care to at least 10% to 15% population of this distant land at the moment. I think this could be considerably bettered in quality and enlarged if we get help from good people like you.